when you look at something like this, at first, when you understand anatomy, physiology, and neurology, you think, hey, this is not a big deal. You know, it has to do with autonomic regulation. But when you look at this, you're talking associated conditions like fibromyalgia, Lyme's disease, all of these. So let's look at, we're going to look at what the standard medical world thinks of this and what really is going on. Okay, now, National Institute of Health, and I got to tell you, when you look at these guys, Postural Orthostatic Tachycardia syndrome, orthostatic, POTS, is one of a group of disorders that have orthostatic intolerance as their primary symptom. Orthostatic intolerance describes a condition in which an excessively reduced volume of blood returns to the heart after an individual stands up from a lying down position. Now, I've got a challenge with their definition, but also when you look at the supposed definitive experts like the Mayo Clinic, National Institute of Health, you're going to start to see that they really don't know. Okay, so just look at the symptoms, and I want you to think of this about how the body's adapting to its environment, because if you go from sitting to standing, and you can actually palpate your heart rate if you go from laying down to standing, the heart rate actually increases just a little bit in order to get the blood flowing. So now, what are the symptoms of POTS? Lightheadedness, fatigue, sweating, tremor, anxiety, heart palpitations, exercise intolerance, headaches, sleep disorders, weakness, hyperventilating, shortness of breath, dizziness, vertigo. When you look at this, who's affected? Now, it's interesting that between 75 and 80% are women. You know, we're looking at statistics similar to fibromyalgia. And, you know, between 15 and 50 years of age. So when you look at that age group, you're thinking, well, isn't that around menses? You know, so that could be a factor. And some women report an increase in episode of POTS right before their menstrual periods, because remember, we're talking about a low volume. So if you're bleeding, okay, you have a low volume. After pregnancy, which makes sense because you're just also reducing volume, major surgery, again, volume reduction, some type of trauma or viral illness, and you're looking at about 3 million Americans. And these are just the ones that are diagnosed. So you're looking at fibromyalgia-like symptoms in POTS, chronic fatigue, you're looking at all of these things. And I love this. This is just absolutely psychotic that this would be printed. Doctors aren't sure what causes the reduced return of blood to the heart that occurs in orthostatic intolerance. And the way they word it, orthostatic intolerance, it's almost like the body doesn't know what's going on. Okay, and I want you to, you know, look at that intolerance, or that lack of communication between the brain's proprioceptive firing, how the brain views its position in space, and the problem. But when you look at this, doctors aren't sure what causes the reduced volume of blood to the heart that occurs in this intolerance, or why the heart begins to beat so rapidly in POTS. Current thinking is that there are a number of mechanisms, no kidding. Some individuals have peripheral denervation, neuropathic POTS. Some symptoms are due to sustained or paroxysmal overactivity of the sympathetic nervous system. That's a hyperadrenic POTS. And some POTS have to do with a significant deconditioning. So if you don't know what causes it, but then they're talking about the autonomic nervous system, some type of peripheral compression of the nerve or alteration of nerve, and deconditioning. So, well, now the therapy, and this just drives me crazy, therapy for POTS are targeted at relieving the low blood volume circulatory problems could be causing the disorder. No single treatment has been found to be effective for all. A number of drugs seem to be effective in the short term. Whether they're helped in long term is uncertain. Now, when I was looking at this one, doing the research, it was this Mayo Clinic doctor. And he's, you know, very serious, nice suit, good looking suit actually, a lot better than what I'm wearing. And he says, you know, we've talked to the patients and we've experimented around with different drugs, and we've really found the beta blockers absolutely effective and much more effective than the calcium channel blockers and the and the diuretics. The beta blockers seem to be it. And then in the other research that you're going to see tonight, beta blockers are one of the causes of POTS. Okay, now the National Institute goes on to tell you, so now first off, they're experimenting with a number of drugs. Simple interventions such as adding extra salt to the diet and attention to adequate fluid intake are often effective, such as drinking 16 ounces of water before getting up can also help raise the blood pressure. There's evidence that an exercise program could gradually improve orthostatic tolerance. Wow, we don't want to suggest water, salt, and exercise. Think of this. They're talking about low volume. That means low blood volume. If there's low blood volume, doesn't it make sense that the heart would have to work harder in order to get blood up to the brain? Okay, now they're saying, oh my God, if you drink water, that's going to increase the blood volume so the heart won't have to work as hard and we're going to get more volume up to the brain. Okay, postgraduate medical journal. Impaired innervation of the veins or the response to sympathetic stimulation plays a key role in the pathogenesis of POTS. There is a sympathetic cardiac activity without vasoconstriction inducing a fall in central venous pressure. Partial dysautonomia, and this is the autonomic nervous system function, can be caused by various stressors and has an immediate mediated pathogenesis. And when you start looking at the symptoms, initially worsen until the patient reaches 16 years of age and then gradually fade away. This is thought to be due to the autonomic imbalance. And you're going to find out what affects the automatic nervous system, the autonomics. And it's going to be physical, chemical, and emotional stress. But when they're talking about vasoconstriction, imagine if you had a hose and you constrict the end just a little bit, what happens to the pressure? It increases. Okay, and that's the same thing what the body does. In order to increase the pressure, the blood vessels constrict. Okay, in order to allow greater pressure, it reduces the volume, so the same pressure over less volume. And if you want to lower pressure, you're going to vasodilate. So think of like the same volume going through a big river. Okay, if it's dilated, it's going to go a lot slower. Now, I love this. In some primary cases, there is a hyperadrenergenic state leading to increased norepinephrine. So this means the adrenal glands are going to fire off. So that's physical, chemical, and emotional stressors. These variants can cause profuse sweating, anxiety, tremulousness, and the diastolic pressure is high. So that does make sense. Remember the sympathetics? It's the fight or flight system going on. Now, other factors involved with POTS. It suggested that disturbances in the central serotonin production and regulation. Ooh, where was serotonin produced? Oh, the gut. So we're talking decreased nerve supply to the gut or abnormalities to the gut. Like what about things that disrupt the microflora, the microbiome in the gut? Could that be contributing to low serotonin production? Cool. Selective serotonin reuptake inhibitors, the SSRIs, increase nerve communication and stimulation with the standing vasoconstriction reflex. This reduces venous blood pooling and increases orthostatic tolerance. This is beneficial in controlling the symptoms in patient with POTS. Wow! You know, if it wasn't for the suicidal thoughts, and suicidality, and the lack of understanding of the mechanism of clinical action, and how if you're on these antidepressants for more than 5 years, you have a much greater risk of being diagnosed with bipolar disorder, this would be a good option. But aside from killing yourself, killing others, and developing bipolar disorder, that wouldn't be an option. Honest to God, I'm reading this and they're saying, yes, this could really work. How about instead of taking a drug that has all those negative side effects, we actually look at what's causing the low serotonin production in a normal human? Okay, was that too much common sense? Okay, good. I'll talk slower. Now, this is good, the Postgraduate Medical Journal. A review of all the drugs which the patient is taking. Drugs which can aggravate the symptoms of POTS include angiotensin-converting enzyme inhibitors, alpha and beta blockers, calcium channel blockers, diuretics, wow, tricyclic antidepressants, phenothiazines, and wow, look at this. They're antidepressants and blood pressure drugs. Think of that. Okay, now, I don't want to go like crazy on this one, but drugs that lower blood pressure, does that raise oxygen and blood to the brain, or does it slow it down?
Slows it down.
It slows it down? You know that I get people in here with high blood pressure drugs, and we're talking like 4 and 5 of them, and they're coming in with brain fog, fatigue, dizziness, lightheadedness, and they go from sitting to standing, they almost fall down. In fact, they come in, they fell down because they hurt their arm, crazy stuff. And I'll say, well, you're taking some blood pressure drugs here, and you're dizzy and lightheadedness. I think you may be over-medicated. What do you mean? Okay, you're taking a drug that's slowing down the pump. Do you think this is helping oxygen your brain or slowing it down? You know what answer I get? I'm not a doctor. Good God! I just had a vent. I'm sorry. Okay. Here's a little bit of brilliance here. Any such drug should be stopped first. Once the diagnosis is confirmed, aggravating factors such as dehydration, so that would be corrected with water, extreme heat, and excessive consumption of alcohol should be avoided. Never again for breakfast, Heidi. Okay, so when you look at this, we're just going to go through ACE inhibitors, because remember, what's POTS? You stand up. Do you know the benefit of passing out? Has anyone ever told you that? Your brain controls and coordinates every function of the body. Okay, and it requires 20% of your body's oxygen. If you get up and the brain gets less oxygen, the body in its wisdom kicks the legs up from underneath so the brain can get level with the ground so the brain stays alive. So anything that reduces oxygen to the brain is bad. Let's look at some blood pressure drugs, because obviously the human being is an animal that can't regulate itself. ACE inhibitors. Feeling like you might pass out. Problem with that, anyone? Okay. Urinating less than usual, not at all. Rapid weight gain, fever, chills, muscle weakness, pounding or uneven heartbeats. Chest pain, slow heart rate, weak pulse, muscle weakness, tingly feeling. What's the side effect of beta blockers? The one that the Mayo Clinic recommends for treatment of POTS. Uneven heartbeats, feeling lightheaded and fainting. Postural Orthostatic Tachycardia syndrome. Okay, and they're going to give you this to treat it. Feeling shortness of breath with mild exertion, swelling your ankles and feet. No problem. If you have swelling, we're going to give you a diuretic. Oh shit, that causes it too. Okay, depression and anxiety. No problem. We can give you an antidepressant because we know that helps with the serotonin. So you can take the beta blocker along with the diuretic along with the other thing. Okay, calcium channel blockers. Feeling like you might pass out. This is off of the labels. Okay. Swelling in your hands and feet, pounding of the heart. So if you've been diagnosed with POTS and you're taking some blood pressure drugs, take the sheet over to the drug dealer, not the pot dealer, the one that's giving you the prescription drugs. Lightheadedness, dizziness, okay, side effect of diuretics. Now this is something that causes your kidneys to lose nutrients, particularly potassium. This is why a lot of times they give you omega potassium or an MK with a diuretic. Why? Because if they don't give that to you and you lose potassium, what's that big pump in the chest? Heart. Yes. Okay, that stops. If the heart stops, it's really, really bad. I know. Klingons have 2 hearts. You're right. That's Star Trek. Diuretics, feeling like you might pass out, severe pain. I mean, and then you go to the tricyclic antidepressants, and this is one of the most prescribed drugs. Cardiovascular effects, okay? Heart attack, stroke, non-specific ECGs, central nervous system and neuromuscular, and you're looking at coma, seizures, and these are all drugs that, for depression and anxiety. Anticholinergic, paralysis of the ileus. Okay, this is part of the intestinal tract, and you're going to see one of the things is gastroparesis, or slow movement of food through the intestinal tract, and these things can cause it. Gastrointestinal, endocrine, I mean, it's psychotic. So I mean, bottom line, what do we know so far about POTS? Okay. Occurs before menstrual cycle, during pregnancies and after pregnancy. So we know that there's a volume issue, so low blood volume. Can be caused by surgery, trauma, and viral illness. Again, low blood volume. Associated with overactive sympathetic nervous system. Now, when the sympathetics hit, okay, that's to run away from a tiger. So blood goes to the arms and legs. Where does it flow from? The organ systems. Okay, so that makes sense. So if we're talking about the organ systems not getting it, your arms and legs are getting it. Autonomic is out of balance, associated with a lack of proper nerve supply, weakened immune system, lack of conditioning, a sedentary lifestyle. Water and salt intake are very effective treatments. Chronically stressed people, hyperadrenic state. Serotonin production regulation, so we know that there's some type of gut issue, and several medications cause it. So let's look at the stress response first. The amygdala. Now it's aware of your environment. Now, once this perceives danger, it instantly sends a signal to the hypothalamus. And the hypothalamus, it's like the command center. It's going to go over, talk to the pituitary, it's going to talk to the autonomic function, the autonomic nervous system. And we've talked about this before, but I really want you to get this. You've got two halves of this autonomic nervous system, and they're talking about a dysregulation of this being involved in POTS. Well, you've got one part fight or flight, and this is physically located in the thoracolumbar area. It's an actual location in the body. So if you have trauma to this area, oh, didn't they say trauma was part of POTS? Yeah. Or if there's physical, chemical, or emotional stress, this sympathetic activity is firing off. Now, the other aspect, the rest, digest, and repair, is the parasympathetic. Okay, and that regulates blood supply to the gut, blood supply to everything. But ultimately, it's the brain. Now, when we're looking at, this is a normal sideways curve. This is an abnormal curve. Now, why do I put this up? Because that spinal cord houses and protects the brain. But what I also want you to see is when you're looking at this, that little line at the top, that's the top bone in the neck. And C1 actually surrounds the cardiac and respiratory center. And so when you're looking at C1 from the side, you can't see a hole in my hand. For you to see a hole in my hand, I would have to turn my hands this way. And that C1 literally surrounds the brainstem area, the cardiac and respiratory center. Now what you're looking at here is this giant hole there is C1 spun off to the side. Now what kind of symptoms did she have? Rapid heart rate, difficulty in breathing, okay? I mean we're talking headaches, all that stuff. Postural insufficiency. So when we look at this, you start thinking, wow, that's really bad. Depression, high blood pressure. Why would she have high blood pressure? Because the brain's not getting enough oxygen. It's an adaptation. So high blood pressure isn't a cause. It's an adaptation to a toxic deficient environment. When you look at this, I mean, this brain keeps us alive. We have to keep that working. Now, you've got a sensor, okay, in the neck, and you got the heart here. It comes up and it's got an artery that splits, that goes to the inside and outside. At that bifurcation, that junction, there's a chemoreceptor which senses carbon dioxide levels. There's a pressure sensor that senses blood pressure. So if carbon dioxide levels go up, then the heart rate goes up. It literally tells the heart to beat faster until the carbon dioxide levels come down. Okay, does that make sense? And it's right there. I mean, you can literally see it in a cadaver. Now, it also, when you go from sitting to standing, it senses that low pressure and it sends a signal down to the heart. So it's actually a mechanical neurologic sensor. Okay, does that make sense? Now, I know what you're concerned with. Okay, you're thinking, my God, we should go to Africa because don't giraffes have the highest blood pressure of the animal kingdom? You're quite right, they do. Why would that be? If this animal, that's neck is about 15 feet in the air, do you think they would require higher blood pressure?
Of course.
Yes or yes? Now, what if we gave this giraffe a low amount of water and they went from laying down to standing up? Do you think they would have to have a very rapid heart rate to get oxygen to the brain? Okay, I mean, if I put a picture of a human up there, I don't think you'd get the whole deep idea that this is not a disease, it's an adaptation to a toxic deficient environment. Okay, so now if he developed higher and higher blood pressure, would we give him a beta blocker, ACE inhibitor, calcium channel blocker, or a diuretic? Or would we just give him some water? So when you're looking at the two things, oh my God, water, salt, exercise, appropriate nerve supply, that all makes more sense. Now, the adrenal glands, this is the fourth adaptation to stress. When we look at it, it secretes adrenaline. Now, adrenaline, there's no off for it. Okay, this is a stress hormone, increases heart rate, increases blood flow to the muscle and heart. Pulse rate goes up, blood pressure goes up, breathing, respiration goes up, sight and hearing and other senses become sharper because this is what we do to stay alive. But there's no off regulation for it. So it keeps flowing around in your system until it's burned up, until it's used up. Now, we've got this HPA, or hypothalamus pituitary adrenal axis. And this is how the body works and survives under stress. So the hypothalamus is initiated. It goes over, talks to the pituitary. And it's going to tell the pituitary to start secreting or telling the different organs to either slow down thyroid function and increase the adrenals. If the adrenals are up, cortisol, when the threat passes, cortisol levels fall. And parasympathetic nervous system decreases the stress response. So when you have this under sympathetic or fight or flight, the parasympathetic is depressed. When the adrenal glands are firing off, cortisol is released. So isn't POTS just a response to deficiency, toxicity, or stress? It kind of sounds like it, doesn't it? Now we got three stressors: physical, chemical, and emotional. And are we under stress? Yeah. Well, let's look at it, okay? First, we've got cortisol, which is absolutely incredible. It's the greatest anti-inflammatory known to mankind. And your body makes a bunch of it under stress, but it needs cholesterol in order to build it. In fact, you need cholesterol in order to build virtually every hormone, every glucocorticosteroid, mineralocorticosteroid, sex hormone in the body. So if someone's chronically stressed, does that mean that they're going to have elevated levels of cholesterol? Mm-hmm. Yeah. Why would you give somebody like that a statin drug instead of dealing with the chronic physical, chemical, or emotional stress? That would make more sense. Because under chronic stress, what's going to happen? You're going to have too much glucose in the body because the liver is going to be breaking glycogen down to glucose. Blood sugar levels are going to be increased, so misdiagnosed with type 2 diabetes. Decreased protein synthesis, this means the joints are going to start popping. Muscle wasting, osteoporosis, wrinkly skin, lymphatic problems. I mean, this is incredible. Chronic adrenal fatigue. Chronic adrenal fatigue. Look at this: heart palpitations, low blood pressure, headaches, weak immune system, vertigo, dizziness. It's all makes sense. So this is the solution to POTS, or Postural Orthostatic Tachycardia syndrome, or the intolerances, how the body responds. Vaccinations. Stop them. Get educated on it. Okay. Antibiotics. Those are poisonous molds and toxic to your gut flora, where you produce the serotonin. Medications. We know that reducing blood pressure to the brain might not be the most effective therapy for good brain health. Environmental toxins, GMO, what do those do? They destroy the normal gut flora. Nutritional deficiencies like water, okay, and salt, honest to God, and chronic stress. So when we look at this, so I go in there and I think, let me do a quick search, okay? I type in vaccines causing postural orthostatic tachycardia. We get 9,440 results. I go to the first one. It turns out Medscape, okay? And this is out of several journals have been using this, okay? Orthostatic intolerance and postural tachycardia syndrome has suspected adverse events of vaccinations against the HPV virus. Orthostatic intolerance and other symptoms consistent with autonomic dysfunction. Gee, that sounds like a host of different diseases. Okay, autonomic dysfunction. Okay, that began in close temporal association with the quadrivalent HPV vaccine. Further work is urgently needed to elucidate the potential for a causal link between this and the vaccine. Now, knowing that this vaccine, one vaccine is worth about $30 billion a year, do you see a lot of companies rushing to find this cause? No. So it's time we take back it. See, our government only has power if we give it to it. Do you understand? So if you have a job that you're being forced to vaccinate in, which has only been since 2010, if your child can't go to school, yes, I know in California, if your child has full-blown hepatitis, he can go to school. If he has AIDS, he's not going to be out. He's not going to be kicked out. He can still go to school. But if he doesn't have the hepatitis vaccine or the human papilloma vaccine, because remember, HPV is essential for cervical cancer if you have no knowledge of anatomy, physiology, or microbiology. This is just a rough association that it's associated, the HPV, Gardasil, just one less. Yes, I know they're giving it to boys, and I know they don't have cervixes, but if your son does not get this vaccine for cervical cancer, because it may prevent genital aborts, although it looks like it may cause postural orthostatic tachycardia syndrome, he can't go to school in California. We got to stop this. We're the only ones that are allowing this psychosis to go on. Okay, so when we put this up and we say these are the 5 keys to solve a number of different conditions. Why? Because it respects the intelligence of the body. If somebody stands up and they're dizzy, that's an intelligent response because there's not enough oxygen flowing to the brain. So you got to check the nervous system. That is how you communicate with your environment. You got to get regular exercise. We know that works. We have to eat appropriate foods and nutrients. We have to sleep in prayer and meditation. What happens with chiropractic? You get pressure off the nervous system. What rationale is there for autonomic function? The JMPT, Journal of Manipulative and Physiologic Therapeutics. Okay, when you read this, okay, this is how most journal articles read. Recent neuroscience research support the neurophysiologic rationale for the concept between the aberrant stimulation of the spinal and paraspinal structures may lead to segmental organized reflex responses of the autonomic nervous system may in turn alter visceral function. High velocity and low amplitude manipulation of the thoracic spine appears able to influence autonomic output to the heart. Okay, I'm going to translate that for English. Okay. If you have a problem, if you have a problem in the area where the sympathetic nervous system is, and you correct that, then you change the visceral or the organ system nerve supply and function. Does anyone want to, duh? Yeah, I really needed a study on that one. Okay, exercise. Why is exercise good? So obviously, got to get your nervous system checked. Next, exercise. Improve brain function. Lowers your risk of cancer and heart disease. Interesting. How does breathing affect? So when you're exercising, you're breathing harder. What does that do? It moves lymph, reduces mental and physical fatigue, stimulates the parasympathetic nervous system. That's the rest, digest, and repair. Oh my God, that makes so much sense. Helps eliminate toxic waste, helps strengthen your immune system. It's interesting too. Toxic CO2 waste is eliminated directly through breathing. Remember that sensor there? What was it? Carbon dioxide sensor, okay? And a baroreceptor. Oh my God, this makes such great sense. American Journal, or the Journal of the American College of Cardiology. Exercise training increases cardiac size and mass, expanding blood volume. Remember they're talking about blood volume? And thus improve or even cured POTS. Wow! Exercise and water. Oh! How much water? Okay, it's got to be healthy water. 50% of your body weight in ounces a day. 100-pound person, 50 ounces of water. 200-pound, 100 ounces of water. I mean, it just makes sense. But the water in this country is toxic. If you're drinking fluorinated and chlorinated water, that's going to negatively affect your thyroid, okay, and that's going to put you in an adrenal-dominant inflammatory state, so you have to clean the water, okay. The Dalton filter I like. I got one on my boat, one for here. It works, okay. I mean, because all you just need something to take out the fluoride and chemicals, leave the minerals in, you know, nice, simple, easy. And don't drink out of plastic. Now, table salt versus healthy salt. That white stuff on the table is manufactured by taking natural salt, such as crude oil flake leftovers, heating it to 1200 degrees Fahrenheit. During this extreme process, the chemical composition is completely altered and most of the nutritional benefits are destroyed. So what's standard table salt? You know, people think it's weird that I'll bring my own little thing of Celtic sea salt or Himalayan salt. But I like salt. It's good for you. Salt ends up to be, or the table salt, 97% sodium chloride. And the rest is not good for you. Okay? Now the American Heart Association actually recommends 1.5 grams per day. However, this is the rate of heart attacks, and this was the definitive study. You're talking 17 countries, over 100,000 people, because you know how some psychos think that too much salt is bad for you? Well, it turns out that instead of 1.5, if you're taking 4 to 5 grams per day, it's actually way less of a heart attack risk. This is a brilliant MD, Eric Topol. The American Heart Association, however, isn't backing off of its 1.5 grams per day sodium guideline. Yeah, why would you let knowledge and advancement of science and studies change your opinion? Particularly when human lives are on the line. Let's hold the line, baby. Okay, but I think there's a big lesson here about guidelines without adequate evidence. They can do harm. Yeah, but way more death rates. Hopefully this lesson will prove to be impactful, because certainly has not been the case to date. Has in cholesterol, LDL, blood pressure, PSA, prostate-specific antigen, mammographies, and a very long list of poorly conceived, non-anchored guidelines. This is a man, baby. This is a guy who's looking at science and saying, good God, this is not right. Isn't it about time we recognize that there shouldn't be rules for populations? Is he talking about treating each person as an individual? Radical. Okay. Some people are exquisitely sensitive to salt intake, while others are remarkably resistant. The average is over. Wow. Treating everybody as an individual, that would really change. I like that. It's pretty crazy, but I think it might work. Look, I got to take an x-ray on every person that I think has nerve pressure. Each person is different, I swear to you. And I'm talking 20 years of doing this, thousands of people. I have never seen two people with the exact same spine. I would love to do the same adjustment. My God, it would be so wonderful. I still haven't found it yet. It's like a friggin' snowflake. Well, I mean, two snowflakes. Sorry, you know, they're like different. Okay. Celtic sea salt, Himalayan salt, 60 trace minerals, help you stay hydrated. Good. Sufficient sodium levels, balance your sodium, potassium. Powerful electrolytes like magnesium are in there. Digestive enzyme enhancers, helps your body to absorb more nutrients from the food you eat. Salt is actually, if it's good and healthy, is good for you. Now, when you look at the benefits of this, I mean, this is like crazy. 84 elements in the body, helps regulate the water content, promote healthy pH and balance your cells, promotes healthy blood sugar, can reduce signs of aging. You know what they're still doing, okay, at these, where do they call them when people are being drugged out and stored? Oh, assisted living centers. Okay, good. Okay. They're still having salt-free food over there. Okay, and then the salt they put on is that toxic stuff. It's like, my God, but don't worry, they're following the American Heart Association guidelines. Okay, it helps food particles move through your intestinal tract, supports respiratory health, that gets rid of the carbon dioxide, promotes sinus health, muscle cramps. Celtic sea salt alkalizes the body, balances blood sugars. We're looking at type 2 diabetes correction, increases energy, provides electrolyte imbalance. What else can you do? Vitamin D. So you got your nervous system checked, you've got, healthy salt, healthy water intake, vitamin D production, increases nerve growth, helps produce serotonin. Remember they were talking about serotonin? Elevates concentrations of brain serotonin. Phenomenal. Now, American Heart Association, at least they got this one right. Our research results demonstrated that postural orthostatic tachycardia syndrome patients have a higher rate of vitamin D deficiency. Wow. Vitamin D levels are low in more than half of POTS patients. Amazing. They're probably still recommending sunblock, but hey, at least they're even a blind squirrel's getting a nut. They're getting close. Vitamin D deficiency is linked to digestive disorders. Yeah, so there's low serotonin. Skeletal disorders, osteoporosis, depression, neurodevelopmental disorders, brain dysfunction, chronic infections. Chronic infections, wasn't that one of the causes of POTS? Yeah. Cardiovascular disease, all types of cancer, autoimmune disorders. Amazing. Now, UVB or direct sunlight is the best. 20 minutes a day, build it up. You get darker, you can stay out there longer. Use coconut oil for sunblock if you're going to be out there longer. However, most parts of the planet don't have enough sun. So you're going to have to supplement with vitamin D3. Typically it's 3,000 international units for every 100 pounds, but you need K2 to go along with it. So vitamin D3, you can get it from a supplement or the sun. K2, you're looking at grass-fed organic animal products, fermented foods. Oh my gosh. Look at our videos on how to ferment foods. It's so good, so easy to do. Certain cheeses, magnesium. This is one of the best supplements you can get, and you can get transdermal magnesium by going in that big body of water here. What's that called? Ocean. Pacific Ocean, yes. Okay, so you can get transdermal magnesium by just hanging out in the ocean, or you can get it sprayed, which is fantastic. 80% of Americans are magnesium deficient because how many people live in California or the Atlantic? Okay, magnesium is found in more than 300 different enzymes, plays alone in your body. 3,751 magnesium binding sites on human proteins. I mean, it's essential. Magnesium, activating muscles and nerves. Remember, we've got sensors when we go from laying to standing that communicates to your body through the nervous system. Now, magnesium deficiencies. Look at this. Unexplained fatigue and chronic fatigue. Weakness, abnormal heart rhythms, depression, panic attacks, insomnia, fibromyalgia, neurologic disorders. Isn't that amazing? We don't know what causes it, but yet we do. Okay, sources of magnesium. What about dark green leafy vegetables, nuts, fish, mackerel, beans, lentils, whole grains? And whole grains, we're talking organic. Avocados, dried fruits, dark chocolate. I'm preventing orthostatic tachycardia by having my dark chocolate bar. No, it just tastes good. Okay, it has benefits, but okay. Optimizing your gut flora. Why? Because this is where serotonin is produced. You got to have healthy bacteria. Raw dairy, blended fruits, juiced vegetables. Gut flora is so vital, and this is the bacteria in your gut. It's more important than anything. It produces vitamin, absorbs minerals, eliminates toxins. It eliminates pathogens and can distinguish it. Keeps harmful bacteria under control, aids in production of your own antibodies. It's incredible. And this is how you produce it. Okay, get fermented produce. I mean, it's super easy. You cut it up, put it in a jar, let it sit down for 10 days to a week. To stop the fermentation process, put it in the refrigerator. Vitamin B12 in POTS. Now, this is vital. Journal of Pediatrics, okay, vitamin B12 is involved in production of adrenaline and noradrenaline and is a cofactor in catecholamine degradation and plays a role in myelin synthesis. Our study shows that the association between the etiopathogenesis of POTS and the vitamin B12 deficiency induced sympathetic nervous system baroreceptor dysfunction. Baroreceptor, that's the sensor inside of the neck. B12 deficiency. Guess what they're looking at? What causes a dysfunction of that B12 deficiency? You need intrinsic factor from the stomach to utilize it. So they're looking at a gut issue that's causing a nervous system or proprioceptive response issue. Where do you get it? Beef liver, sardines. And when we're talking beef liver, that's one of the most toxic organs around, so if you're going to eat it, make sure it's organic. Raw cheese, cottage cheese, lamb, raw milk. I mean, amazing sources. For vegans, brewer's yeast. So can you see? When we start respecting the body, postural orthostatic tachycardia, not syndrome, okay? Intelligent response. Doesn't that make more sense? Because that's what it is. There's no syndrome. Okay, it's an intelligent response. You get your nervous system checked because that's where your body views the environment. Exercise, we know the data says it can solve it. Proper nutrition, absolutely. Sufficient rest and prayer and meditation. Does that make sense? Okay, and for the internet trolls that typically, no, don't run. I'm just kidding. Okay. Reference. Okay. Look it up. The data's there. Okay. Respect your body. Now, any questions? The doctor's telling you they got too much vitamin D. Yeah. What's psychotic is they're measuring you against the entire population. Unless you're downing massive amounts of supplements and you're just getting it from the sun and appropriate food or supplementation sources, that's normal. There's not going to be an excess. See, just like we were talking about treating each person as an individual, he's trying to categorize you. Yeah, they're trying to hold it at like 25, okay, and then you might be 26 or 27. You know, those ranges on blood test, they're rough guides. Unless it's like cholesterol, which it's a totally made up guide. Unless it's vitamin D, which is a totally made up guide. They're coming up with these guides that are the same for everyone. Should everybody in the world have the same vitamin D level? No. What if you're going through certain health issues, like some type of autoimmune dysfunction, okay, or some type of lack of ease or disease process, okay, some type of chronic inflammatory condition, okay, you're going to require different levels. So what you should say is, wow, your vitamin D levels are higher than normal. Let's find out why. What other things do you have going on? Are you taking in a lot or are you requiring a lot? Okay, would that make more sense? Yeah. Yes, sir.
So what's the best way for me to figure out personally for my body what the best amounts of a lot of these different vitamins and minerals are?
It's a total guess. It really is, because the best way to do it is like you'd find out for food. You do metabolic typing. You try it for a few weeks and see how you feel. Because your cholesterol levels go up in the wintertime, they go down in the summertime. Okay, your nutrient needs are going to be different throughout the world, okay, throughout the year. That's why in Northern Europe and cold winter climates, they would eat fermented veggies. Why? Because they didn't have refrigeration or anything, so they would ferment them so they would last. Did they know that they were loaded with vitamin K2 that was helping them, and then they're getting the vitamin D from the fatty fish? You know, or did they just eat it and found that they survived?
So what about this concept of looking at the blood, looking at my blood, and looking at what's where the current levels are?
Yeah, a live blood cell analysis is accurate. The standard blood cell or the standard blood test is completely inaccurate. The standard blood tests are only 10 to 15% of a diagnosis at best. But most doctors, naturopaths, homeopaths, they're using that as their only guide, when everybody's going to have different blood levels. A live blood cell analysis is a lot more accurate, but that can change in a couple of days. So it's a snapshot in time at best, And that's why it's tough, because if I go in and I say, yeah, it's 3,000 international units for every 100 pounds of body weight, don't take that as gospel. You might need more. You might need less. Okay, what's neat about certain things, like we're recommending about 2,000 milligrams of vitamin C with bioflavonoids for the average, four times a day. If you're too much, you're going to be urinating it out. Too little, you need more. Any other questions? Because next week it's going to be exciting. Lupus, cause and solution.